Thank you, Apurva, and it's indeed a pleasure to be part of the UOC session here at AIOC on a virtual platform. I think something that is an amazing conference ongoing, and thanks AIOS for the opportunity. I'm Dr. Digvijay Singh, and I am currently practicing in Gurgaon at my center, at the moment. And I am now going to speak to you all about a topic: incorporating video consultation in your day-to-day practice and how to get future ready. And the reason I chose this topic is because I think this is something all of us need to do sooner or later. My slides are visible. I'll proceed. So,
yes,
this is so video consultation has come about in a big way post the lockdown, post this COVID pandemic. In fact, a lot of the rules were actually framed after that. Even though video consultations were happening before that, predominantly in the ophthalmology field, if you were to look at it, they were happening in the way of connecting renal centers to the parent institute or to the mother institute, or they were happening in the form of cross referrals between two doctors, or sometimes they would happen in terms for a follow-up if somebody had left the city, left the station, left the premises, and they would occasionally get in touch with the doctor. But other than that, really, there wasn't much of tele-ophthalmology that was happening. But the situation has changed now. And it is now, in fact, the need of the hour for it to happen. And in the current age, it is becoming more and more a standard form of consultation, and more so after the lockdown, and more so during the lockdown periods. That's when people started exploring this option, and they realized that there are certain benefits that this has, and there are certain ways that one can effectively have on consultations on the online platform. Now, the rules of telemedicine were actually framed by the MCI, or the Board of Governors, in March of 2020, just at the time when the lockdown was placed. And the rules are a defined set of guidelines on how to do a telemedicine. And there are certain, so for example, they mentioned that you have to be able to identify the patient and the doctor themselves. There is a certain number of conditions that can be looked at. Nothing invasive can be done. It could just be it could be using audio or a video or a text. It could be asynchronous, which is typically when you do an audio, video, or a chat at the same time. It could be asynchronous in the form of emails. So they kind of have mentioned in their full guidelines, and you can go through these guidelines in the website that I've mentioned, as what counts as telemedicine or teleconsultation, and that who are the people who can do it. And it also gives you certain restrictions within that. It also defines what are the medicines that you can prescribe, or the drugs that you can prescribe based into list OAVX, which is medicines of list O can be given ordinarily, which are most of the times over the counter. Then there's a list A of drugs which can be prescribed after video consultation or on the first consultation, and then there is a second list of drugs which can be prescribed on a follow-up consultation or after a video. And then there is a list of drugs that cannot be prescribed. So they've very well defined the whole process. And they've also mentioned how the consents have to be done, whether it's an implied consent if the patient is calling, or it's an explicit, or you have to take a consent if you're the one who's initiated the video consultation. So the question that arises is, why a video consultation? What is the advantages of doing a video consultation? So, and why should we, in our practices, incorporate video consultation? So let's look at the merits. The merits is that a video is better than an audio or a chat form of teleconsultation because the patient-doctor identification is easier. A good patient rapport is there, and there is an ease of examination as well as the ease of counseling and explaining. So this is why a video is better than other forms of teleconsultation, right? And we'll also come to why it will help you in your practice in a bit. The demerits of a video, of course, are that there are privacy concerns, particularly a patient's picture may be taken, a patient may have, there are certain ethical aspects that need to be looked at, and you require an infrastructure which has a good video camera on both the sides. So sometimes the low resolution ones won't do the trick very much, or if there's no good internet connection, you're unable to do it in a proper manner. What are the suitable situations for a video consultation in the ophthalmology practice? And this has been, this has come in a good article in the Indian Journal of Ophthalmology. And so we know that the first consultation in cases of things which are visible, whether it's a stye or a chalazion or a red eye, is something where this is very helpful. And in my practice, I've done a lot of that now, consults for that. Then you can use it for consultation for optimization of medicine. So I've given a certain eye drop, let's say a patient had dryness, I've given them a certain eye drop, and I want to ask them in a week's time, are you doing better? Do you need more? Do you need less lubrication? And things like that. So to optimize that, or to follow up a patient who's an uncomplicated surgery patient who doesn't have any complaints at all. It can also be used for counseling. So counseling for, let's say, LASIK, counseling for a diabetic patient, and for glaucoma, counseling for cataract. So it's something that you can do for counseling as well. as well as for cross consultation with your colleagues. So you can take, the patient can connect with you, you can take some images from the patient, and then you can refer to your colleague and take a cross consultation as well. In trauma, it can be used for first aid and for triaging that, this is urgent, please go to a nearby center. But there are certain unsuitable situations where you should not do it, or there are certain limitations. You cannot, as per the law, use it for invasive procedures or for certain surgeries. You cannot use it for training purposes. You cannot use it for cross-border. You cannot use it for an international patient at the moment. Your prescriptions are not going to be valid. And so on and so forth. There are a few of these unsuitable situations where you should not use video consultation. Now, incorporating in your practice, what is the need for it? So one, it is the need of the hour. Two, it is a source of patient connect even during the lockdown. So it was a major source, right? Because the patients during the during the lockdown could not get in touch with you. They could not come physically. That's where we realized that this is what kept the connect going. And doctors who had shifted to this early, were able to keep their patients with them and well connected. It also expands the catchment area, right, to the whole of the country, because anybody can do a video consultation from anywhere within the country at all. So that was one. It also expands our hours. It gives us a flexibility to work from home, which is something which is very unusual for a doctor in a way. And it also, and as there is a shift in the consumer practice, in the pattern, like the patients who are shifting to an online mode, this is something that you must have in your practices now. How would you go about it? So first, the way to go about it is to set up the infrastructure. So you need to have a good camera, a good screen, a good mic, a good headphone. You need to train your staff to be able to, connect the patient and get them connected to you. You can also do it yourself. Most individual doctors can easily do this yourself. You need to price it. It may not have to be at the same price as your OPD consultations. And in the beginning, the OPD consultations were at a higher price. This was priced very low. Still did not get patients, so they priced it even lower. But now the prices have come back to closer to the OPD consultations for this as well. So you need to strategize your price. Record keeping is very important in this because there are medical aspects and legal aspects, and we'll come to some of those as well. That's a very, very important thing. And it helps you, expand over your practice hours, as well as it's important because you need to market it as well. So you need to, tell people that this is something that you are doing. It can be done through various apps and portals. So we can either do it in the form of a telephony portal, whether it's WhatsApp or Skype or Viber or FaceTime or Zoom, or you could use certain third-party apps that are available, or you could use your hospital's own EMR software, which can now be tuned to do video consultations. So you can use any way. The main tip and trick is that you expand your hours of service. So give more hours for the video consultation, which you could even be at home and do it. Club certain video consultations together. Otherwise, it becomes very disturbing in the day. There's one video, then 3 patients sitting, then another video comes in. So try and club them if possible when people take appointments. Keep a prescription pad ready. Write the prescription there and then, take a photo and send it to the patient. It's very important. You should have a planned first and second line treatment. If I get a red eye, this is what I'll do. If I get a swollen lid, this is what I'll do. Get the patient to assess themselves at home. You can tell them to look at smartphone app. Some apps are available which can help them test their vision at home, help them test their color vision at home. So you could use that. Ask them to send you a photo in advance. And you could use a hybrid model where the patient comes to a clinic or goes to an optometry center, gets their vision done, and then connects with you as well. The demerits, are, as we discussed, that there is a legal implication of this because the accuracy of a diagnosis on video consultation is not as good as what an in-clinic diagnosis is done can do, but unfortunately the legal implications are similar. So a doctor who is diagnosing somebody on a video consultation is as liable as somebody who's done it in the clinic practice. There are ethical and privacy concerns. There are issues with record keeping because, it's not easy to keep records of video chats, even though you've got a prescription, but exactly what had happened, or, you don't sometimes write all the details down. So these record keepings becomes difficult. And, this does come under Consumer Protection Act as well. And since there is a lack of touch and feel and there is a limitation on drugs, you can't exactly give the same experience or the same advice to the patient as you would normally do. Now, what is the future? And we need to know that the future is now shifting to healthcare at a home concept. All right, which basically means that more and more people are very busy. It's difficult for them to come to the clinics. Keeping the pandemic in mind, more so their mindsets have changed. They realize that they can do certain things at home. And there are a lot of organizations which are providing home visits. Particularly on the optometry front, they go into the refractions at home. So people are shifting in trend. So this is one way of catching up with that trend. So the other thing is a lot of devices have now come out in the market, such as the home tonometer that you can see in the center here, or you can see this fundus camera, a smartphone-based adapter, which people can take fundus photos at home and send them to you. So this is again something where the video consultation can adapt because you tell them that this is a device, you can take a picture, let's say somebody's a diabetic, needs to do it every 6 months, or somebody's a glaucoma patient, needs an eye pressure check every other week. He can do that from home and get in touch with you as well. Technology is improving in the smartphones. A lot of devices, a lot of apps have come which can help people assess their vision, color vision, Amsler grid, everything on the smartphone. And a lot of people can do it from there. So that's again something that you must know, that there are clinical projects going on by certain companies where they are sending optometrists to people's houses, or sending technicians to people's houses and assessing them and then getting them connected from there by having done a cursory examination. And this is again something where the video consultation is going to really pick up in the future. And now with good quality resolutions, we are coming to a situation where this is going to become a very standard form of consultations at all. So I thank you for your time and look forward to any discussion on this. Thank you.